Okay. So it's 1:08, so I think we should get started. This is our third meeting for the work group for the community health needs assessment that's due the end of next year. So time certainly does fly. As I had said just a few minutes ago, I think this will be a quicker meeting because we're halfway through the community-based organization questionnaire survey that we want to send out. So we just have to go over a few more questions there. And so I think it might be a quicker meeting. Unfortunately, there'll be no rendition of all that CHAS this time around as there was last time. So if you were on last month's meeting, you missed my rendition of all that CHAS for Community Health Assessment Survey. So anyway, today's meeting, we have to get consensus on the community-based organization survey. Oh, by the way, this is being recorded. So your participation in this Zoom meeting is your implied consent that that's okay. Just let you know that. Right, so we need to get consensus for our community-based organization survey questions. We've gotten through most of it last time around, so we're going to finish that up today. You've gotten the community health assessment survey for individuals. We've gone through that. We've all agreed upon what should be in there, what should not be in there. Pretty much stayed the same. So that's all done. We're going to go over the timeline again of what we hope to accomplish and when, and the distribution process and how we will get this out to community-based organizations. So I think we can go to the next slide. Please, if you haven't already done so, share your name and your organization that you're representing in the chat box. I took a quick look. I saw Linda Mermelstein and Stephanie Kubo and Stuart Vincent, Kristen Phillips up at Haney's. Just took a quick look. So if I didn't say your name, just because I don't remember, it's there, but I just don't remember it. So introduce yourselves, and we're happy to have you here with us. Let's see. Okay. So timeline, we're moving along, we're making great progress. We, as I said, have finished our review and have all agreed on a consensus of the questions and material in the Community Health Assessment Survey for individuals. That's the CHAS, C-H-A-S. So that's all set, and that's ongoing. We continue to push that out via SurveyMonkey link, paper-based, whatever way we can get that out. We did just receive a staff this morning from a Catholic health facility, and we thank, I think it was St. Francis, I'm not sure, but we do thank you for sending those off to us, and we're happy then we then turn it around and we data entry it ourselves here. So that's that. We have been pushing the link via social media posts and I don't know if we've seen a tremendous uptick, Brooke, in people taking the survey. What have you noticed?
So in the time since we've really been pushing and boosting, we've gotten, I believe it's about 150 responses. And that's since we started it was like beginning of October. So.
Okay. All right. Okay. Well, that's good. And we always like to boost through social media and promote it through social media channels, the link, but it's even more important right now because a lot of the programming that everyone used to hold is not being held, or if it is being held, it might be a hybrid type model, or it might be fully virtual online, which you can still then post the link and ask people to complete it. But we don't have those in-person meetings programs happening as much as they had, although they are starting to pick up. So we are getting feedback. We are getting individuals to complete the survey, which is always very good for us so that we have rich data when we go to analyze it early part of next year. So our plan is to send out the community-based organization survey, which we're going to finish discussing in a few minutes, by mid-November. And we want to keep it out there in circulation for about 2 months until mid-January, so that we have time when the surveys are returned, again, via a link or paper-based. Of course, we always hope that it's done via the SurveyMonkey link. But be that as it may, when we get those returns and any organization rep that has clicked the or check marked the box that they'd like to be part of a follow-up individualized key informant interview, we will then start those in mid-January and or so, mid to late January, take a few weeks to do that. However many responses we get, maybe 10 we get, maybe 20, it depends. The number of responses we get also will determine if we need to facilitate putting together a subcommittee to help get that done. But we're hoping, Brooke and I are hoping we can handle it ourselves. So that's what we plan to do, keep that in circulation until the middle of January. We are going to distribute to the full community list that we have of community-based organizations through the like list. But we do ask you to take a look at that list, and we did provide the link to you to see if there's any organizations or individuals who might be public health experts who are investigating a particular area of health or public health, to please forward their information, contact information to us, and we will include them on the list. We'll add them to the list when we send out a message about this particular survey. And so if you could get those to us, I think we feel like by the next week or so, if we want to send this out mid-November, say by the latest, get that to us by November 10th. Gives you a little over a week just to quick send those off to us. Any individuals, organizations you think we should contact if you don't already see them listed through the link that we provided you with. That link again being the list of organizations, individuals who are part of the Long Island Health Collaborative. So that'll come back mid-January. We'll then see who is interested in having us follow up to do that key informant interview, which we are using the instrument survey tool for the questions from the key informant interviews that were conducted 3 years ago almost by the firm that we hired to do the, they did key informant interviews, but they also did focus groups with individuals. But they do have a document that is, has been vetted and is aligns with the prevention agenda and also with the social determinants of health. So we're going to just take a look at that document. If it needs any updating, we'll do that. But that will serve as our guide to ask the questions of those individuals. So we have that in place. And then between end of January, beginning February, around there, mid-February to mid-March will be all the data analysis that will be taking place, with the goal by mid to late March having all the survey analyses complete, and then sending all of that information to everyone. And we meet then beginning of April to decide on the priorities based upon what the data show that the counties, the hospitals, and the group wishes to work on the next 3 years of the prevention agenda cycle. Okay, just stop me if anybody has questions. Just, we're a small group today, so you just ask a question. Just stop me. Keep me from rambling. I appreciate it. All sounds good, Linda says. All sounds good. Thank you, Linda. Okay, she keeps me in check.
You're welcome.
Thank you. Okay, what do we have next here? I think we're going to go over the survey. So you should have gotten, but we'll pull it up on the screen. These when we sent it, that's the actual community-based organization survey that we're looking at. As I said, we got through to question 4. And if we look at our summary notes from the last meeting, I think we got to question 4. Just hold on a second here. Question 3, we made a decision on question 3. Oh no, that's not that. Sorry, CBO survey. Okay. Question 1, we talked about. Question 4, we got as far as question 4 and deciding what we should do and not. And if you look at your summary, you'll see the changes that we decided upon. So we're up to question 5. Does everyone see that question 5 on the survey on the screen? Or if you printed
Yes.
it out in your hand? And the question is, what types of health screenings and/or services are needed to keep people healthy in the community you provide care to? So remember, these are community-based organizations. These are the county health departments. These are the hospitals that are offering different types of programs, services, and interventions. And we list there a variety. This is what we had some years ago. Then some are very specific. Blood pressure screen, so that would be screening on blood pressure, heart information on heart disease. So this is disease or disease category specific. Stuart has added a question about COVID, and when we last met, when we were talking about the individual survey, we actually felt that we did not put a specific question about COVID in the individual survey because we felt it would be too leading. But we did feel that a place for it would perhaps be the community-based organization survey. So that's a great way to start off our discussion, Stuart, and thank you for bringing that up. The question becomes, again, is that too leading? Is it, because there is a category for other where somebody could write in COVID, or do we have, should we put like infectious diseases? And remember, we have to mirror what is in the, we have to mirror what's in the priority listings for the prevention agenda and the social determinants of health. Last time around, there was a category specific to HIV, AIDS, and STDs. There is not that category anymore. I don't have the current ones in front of me, but it's more, it's general, it's more infectious diseases. And maybe, not that, maybe we should just add, and we can add anything we want because this was only used once in 2013 and it was not distributed subsequently. So there's no historical trending here. This is really, we're starting from a fresh place. So we can add or subtract anything that we feel is necessary to do.
Janine?
Yeah.
I think for question 5, you like, if I was going to say, I thought, we needed, let's say we needed more places to get COVID testing. I would put it under disease outbreak prevention. Like, I think there's a category that would fit that. It's a disease outbreak and it's.
Oh, yes.
It's not so much prevention, but it's addressing the disease outbreak. Or maybe it's prevention if you're testing someone to make sure that they don't spread it. So I'm not, but then maybe like I'm thinking, okay, if somebody has long COVID, is there something, but then that might fall under something more specific like memory loss or mental health or whatever the long COVID issue is.
Yeah. Well, see, the thing we have to ask ourselves again is why would we want to specifically ask just about COVID? Because there's flu, right? There are other infectious diseases that we need to receive a vaccine for every year that we're not asking specifically about.
Yeah.
Like, why do we want to do this?
Right. So, but that would be the only thing that I think you already have a place for it. So I couldn't think of a thing that we would need to add specifically for COVID there.
Yeah, other than just to have COVID, that I want more information, more health screenings and/or services needed to keep people healthy.
Janine,
Yeah,
could we add under vaccination immunizations, maybe have a few sub boxes to check off? Influenza, COVID, maybe some others? Would that be one way to do it? Common
we actually,
vaccinations.
I don't know if you were on the other calls. We actually talked about that, doing that specifically with for the individual survey. And why did we decide against that? I'm trying to remember.
I think it was just the thought that it would be leading to have, only some and not all, like,
Right.
having COVID there.
Okay.
Right. Because there's measles, there's mumps, there's
Right.
diphtheria, there's chicken pox, there's HPV, there's
True.
shingles. It would become quite a long list. Well, Stuart, tell me what you were thinking when you said COVID. What prompted you to say that? Were you thinking more about?
I was just thinking if someone got to this question and they read all these things,
Yeah.
I was just thinking someone might say, well, how come they're not listing COVID? What, obviously that's on the top of everyone's mind and all. So I just thought that would be a question that would come up in the minds of anyone who's taken this survey.
Yeah, well, remember, these are the community-based organization
Sure.
providers who are taking the survey.
Sure. Would they have questions, do you think, or?
Well, that's what I'm trying to put myself in somebody in a community-based or a hospital. You're a hospital, you represent a hospital.
Right.
So this is not like a hospital patient that you would ask to fill this out. This would be like you, Stuart. If this came to
itself.
you, you're
Sure.
thinking, you yourself, why didn't they ask about that? Is that what you're telling me? Like as an organization that offers services to the community?
I think that would come up. I think that would be, it's so top of mind right now. I think that would definitely come up, and it will be for a while.
Yeah.
Can I ask you a question? I mean, maybe like in the I don't know if you send this out with an introductory letter or instructions, but maybe
I'll have a cover letter. We'll send something out.
Maybe what would be beneficial is in the cover letter, you could say something like in 2021, 22, or in this, in this time we're dealing with the pandemic, but we didn't single that out in our survey. It's included among, references to infectious disease or preventable, whatever. So just to kind of put that out there at the beginning, so people will kind of know if they want to talk about COVID, that's where they could put it. With that, I don't know, just a thought.
Yeah, well, once again, I'm looking at the 5 priorities, the new one, the ones that would change slightly for 2019 to 2024 cycle. And under where we used to have a very specific question about HIV, STDs, that was an actual title of a priority along with some other like vaccine preventable diseases. Now it's just prevent communicable diseases. And under there, they have focus area 1, vaccine preventable diseases. Focus area 2, HIV, and then there's different goals. Focus 3, STDs, and then there's a goal. And then Hep C is another focus area. And then the 5th focus area is antibiotic resistance and healthcare associated infections. So, improving vaccination rates and reduce, which is a goal under vaccine preventable diseases, focus area 1. Goal 1 is improve vaccination rates. Goal 2 is reduce vaccination coverage disparities. COVID kind of fits under there because that's what we've been trying to do, increase the vaccination rate and reduce disparity in care. Yeah, so let's see. It's this survey. Okay. I don't know. What are some other thoughts about this, putting the word COVID in there? I'm just concerned that it becomes, it becomes something people automatically check because it is so top of mind. Even though issues about heart disease and blood pressure might be just as important.
Yeah, it almost sounds like what you should do is in the cover letter have this prevention agenda list
Yeah,
of each of
yes.
the priorities and what each of those items are. That's
Right.
what we would do. And then you're saying this, we want you to choose among these. And that's basically what you're doing. Then you don't need it on the survey.
Yeah. Well,
I would agree
Um,
with that.
who was that?
That was
Stephanie.
Yeah, I agree
Stephanie,
with that
Yeah,
because then it keeps it more general. So, people might select that particular category for some of the other reasons you mentioned. And I think it's a good reference to have the priority list there by their side as they're going through it.
right, because, and in that description, and I'll share that with everyone, the cover letters so that so they were more than just my eyes on it and Brooke's eyes.
Yeah. If you just go to this website, I just posted the prevention agenda
With it,
website.
Yeah,
You would just do a screenshot of that one page. It has like each different priority area and each of the subgroups, and that would explain it.
right.
That's a great idea.
Yeah. But what I'm saying is in that, I'll send the link to that and also give them the 5 priorities just to level set everyone. But in that cover letter, when I talk about one is the reason why we're doing this survey, why we need the organization's input. And then we can talk about COVID and what I think, I don't know if Stuart said it or Linda said it or somebody said it. There are, besides needing to be vaccinated or wanting people to be vaccinated for COVID, there are those long haul syndromes, which affect the heart, which affect, I think you said it, Linda, memory loss. And so I can explain that very briefly in the cover letter that this is an opportunity with knowing COVID occurred and is still occurring. There are obviously the issue of vaccination, but there's also the issue of individuals who now have health problems as a result of COVID. And keep that in mind when you are thinking about the health problems and the needs of your community to keep them healthy. Would that help, do you think, Stuart? Would that do it?
I think so. Yeah, I think that's a very good idea. So they'll have some reference.
Okay.
Yeah,
All right.
absolutely.
All right, that's good. All right, so that's trying to see these questions. So that was question 5. So we feel what we currently have for question 5 can stay, if I'm understanding everyone correctly. Because the prevention agenda still does mention HIV, AIDS, and STDs. However, it's now under a priority that's been renamed somewhat, and those issues have become focus areas, which is fine. We got falls, we have emergency preparedness and cancer, cholesterol, dental, diabetes. Smoking, quitting smoking, suicide prevention, vaccine immunization, weight loss, and then other, which people do write in other. You think we're good with what we have, and then with the explanation in the cover letter about COVID? Do I take silence as consensus?
No, I'm still looking at this list. I'm just wondering if all of the things, like they have healthy eating and then food security. So we have nutrition, but we don't really allude to the part that's like the social determinant of health part. So I think we should go through each one of these and make sure we've got it included. So that's what I was.
Okay, so when you say each one of these, you mean
Yeah, like so focus area, preventing chronic diseases, which has been a priority here. So I think that we should make sure we have everything from that one. So you have healthy eating and food security. So, you know,
That's the first focus area under that
Yes.
priority.
so in question number 5, what types of screening and or services to keep people healthy?
Mhm.
We have nutrition. So does that cover food security, or do we
Well,
want to get more?
Can we do nutrition/food security?
I mean,
Or is-
I think that would be more inclusive, and people, you know, if you check that, you'd probably have more of a determination.
Yeah,
Or
or make its own box, food insecurity or food security.
I mean, you might have room for another column there in this one without making this thing longer.
Mm,
At least for food security, probably on that line you could fit it.
Yeah,
I'm saying,
I mean, we could do nutrition and or food security and or, meaning but then you're not sure why are they
Yeah.
checking it off.
yeah,
I would argue they are different,
yeah, they're kind of
Yeah.
different enough.
Then
Yeah.
let's add, I think we can add food security, or would we say food security or food insecurity?
Well, it says what's needed to keep people healthy, so it should be food security.
Food security. So I think we should add a box, another choice.
Yeah.
What does the group think?
I agree.
Okay.
Yeah, 2 yeses.
Yep, focus area 2 under prevent chronic disease is physical activity. And this includes, first goal is improve community environments that support active transportation and recreational physical activity for people of all ages and abilities.
Mm.
What do we have anything about that?
We have exercise and physical activity.
Yeah,
But I almost feel like active transportation could be its own.
I don't really know what they mean by active transportation.
There's more infrastructure to enable, walking, biking.
yeah, I think that's like, so you could walk to work, or when, I
So
mean, are they-
that's, yeah, so that's like, well,
Bike
active
lanes, maybe?
transportation, I have no idea what that really means. If you just think about those two words together, what does that really mean? It's not like physical built environment improvements, or maybe it is.
I
It's
think
like-
that's part of it. It's like all forms of transportation other than cars, really, or at least that's the sense that I've gotten from Let's Move Long Island. It's all about utilizing public transports and physical activity as transportation.
So would it,
Biking.
with a box under exercise and physical activity, if we put a box like called transportation access?
Or alternatives.
I don't know. I mean, if I saw transportation access, to
Yeah.
me, that's like, can my patient make it to their doctor's appointment?
Okay,
You know, you live in Wyandanch,
Right.
and how are you going to get out to
Okay.
Donnybrook? And, I almost wonder if you should have a detailed guide attached and then say, refer to the guide when you're talking about these topic areas.
I don't know,
I mean-
because that full goal
Too
reads,
complicated.
and Linda, you put the link in the chat, right? So anybody who
Yeah.
wants to click on the link, you can follow along with what I'm reading, because I don't want to open up another screen, because we have it side by side up already.
Yeah.
It says improve community environments that support active transportation. I think active transportation in this, if I'm interpreting it correctly, and I'm trying to think the way the state does, means sidewalks and curb cuts that people can actively transport themselves. I think that's what it means.
Yeah.
So in this case, then, we need to know if people feel there should be better
Environments to promote.
environments, better sidewalks, better signage, better lighting. So,
I I mean, I think that almost would be another box, environments to promote physical activity.
Mhm.
But you're gonna run out of space. But
I'm gonna run out of space, but let's just keep going because we can always whittle back if we have to. So far, we've added one box under nutrition, food security.
so for tobacco prevention,
Yeah,
I'm thinking we have quitting smoking.
Mhm.
Then there's like the quote about vaping and the other uses of tobacco. So maybe it should be quitting tobacco instead of quitting smoking.
quitting tobacco products.
Yeah.
Okay.
I
Well,
mean,
let,
this is just
okay.
me. Other people should chime in if they think.
yeah, no, that makes sense. That makes sense. Absolutely. You know, vaping and all of those concerns, we were starting as public health and health practitioners, we were getting very concerned about vaping, the increasing incidence of vaping, but then COVID hit and they're probably still vaping and in great numbers, but it kind of slid to the bottom of the pile when we all had to switch gears and focus on COVID.
I mean, this also has eliminating exposure to secondhand smoke. So just maybe
Where does it have that?
under tobacco prevention, focus 3, goal 3.3, eliminate exposure to secondhand smoke.
Oh, okay.
Goal 3.2.
But wait, let's go back to focus area 2 with physical activity, because we still didn't decide when we have improved community environments that support active transportation and recreational physical activity. What do we want to say about that? Safe places to exercise? Because then that covers making sure there are sidewalks and street lights and stop signs where they need to be, that there are well-lit parks.
You don't think it's understood if you said environments to promote?
No, I don't.
Okay. Because it's not just safe on this, you also have access for the disabled, people of all abilities.
But
Accessible, safe.
that needs to be safe for them too, though, right? I mean, well, I don't know. I don't, well, you guys are the providers that would be answering this. What would you, if it said environments to promote activity, or if it said safe places to exercise, what would resonate more when you think about the clients you serve? Anyone?
I like environments to promote. I like that one.
Okay.
And but I do think, that it might be helpful to have some sort of a definition list, just so that everybody's kind of on the same page with it. So if there is any question,
Right.
we have an explanation.
Well, I think the explanation is going to be the sending this, or it's the link to the prevention agenda priorities and the goals. Because if I start trying to define all of this, it's going to get unwieldy and no one's going to read anything then. So if you feel environment works, you guys are the experts. I'm not the direct provider of services and programs. So if environments, what'd you call it? Environments
Promote physical activity.
to promote physical activity.
Yeah.
You feel that hits it, then that's what we'll do.
I don't know. I mean, I feel like, because I've been talking about this with you for years, so I know what it is. So it's hard for me to say what other people would understand or think of.
Well, me too. And I'm not the one who provides program. Well, I kind of do with the walking program, but I know that program has become very focused on safety, like the streets being safe and that there being sidewalks and there being proper signage. So that's why my brain went to safety, went to safe places.
What would you think about environments to promote physical activity / transportation? Do you think that would encompass like the bike lanes and the sidewalks?
Oh, active, that's what you are feeling active transportation means in this case?
I was just thinking for the option,
Yeah,
but maybe not. Those are two different things. So
no, I think just the environment to promote physical
Activity.
activity, or
okay, perfect.
it should do it. You know, I mean, you could say physical activity / transport, meaning people to be able to walk to work or bike to work.
Those are different though.
You're gonna
Yeah.
have trouble fitting them in.
Yeah.
I think environments, for whatever it was we said the first time, environments to promote physical
Physical
activity.
activity.
It should do it. The second goal there is promote school, childcare, and worksite environments that support physical activity. Okay, so we covered that already. The third goal there is increase access for people of all ages and abilities to safe indoor and outdoor places for physical activity. All right, so we covered that all then.
Yeah.
Tobacco prevention, Linda said to call it quitting tobacco products. Because they have in here prevent initiation of tobacco use, including combustible tobacco and electronic vaping products, e-cigarettes, and similar devices.
Yeah, you might want to say prevent tobacco exposure or prevent / reduce tobacco exposure. I don't know how to say it exactly.
Well, what else does it have? It also says promote tobacco use cessation. It also says eliminate exposure to secondhand smoke and aerosol emissions from e-vape products. Prevent tobacco use. All tobacco related
Product,
Yeah.
product
product
use.
use.
Yeah, the thing
Prevent-
that's not covered is eliminating exposure to secondhand smoke.
Well, you will eliminate it if you prevent it from happening in the first place, right?
That's true.
Maybe prevent / quit. So that you have both the prevention of before people start smoking and helping people to stop smoking also.
Prevent / quit tobacco products.
Or tobacco use.
Or yeah, prevent / quit use of tobacco.
All tobacco
products.
use. Well, I don't, okay, here again, question for the group. When you see tobacco, right? If you refer to tobacco, does your mind go to vaping? Or does it go to traditional tobacco in the form of a cigarette?
I think it goes to what all of the above, vaping, chewing tobacco. And if you hear
It does.
tobacco, I think that that's what people think about is, you know, it's more than
Mhm.
just smoking.
I think of all of it. Yeah.
I think their mind goes to all of it. So if you use the word tobacco use and products,
I
that hits it.
Mhm.
So what about prevent? What did you say, Stu? Prevent /
Prevent
quitting?
/ quit tobacco use.
Yeah, because that takes into account also treatment for tobacco use, which is
Mhm.
another service that is needed.
So does that make sense with everyone? Prevent
Yes.
/ quit tobacco products and use?
Yeah.
Okay. Okay. Also under priority 1, prevent chronic disease, there's a fourth focus area called preventative care and management. And I think we probably cover this because here's about your screenings, increase cancer screenings, increase early detection of cardiovascular disease, diabetes, prediabetes, promote the use of evidence-based care to manage chronic disease, improve self-management skills for individuals with chronic disease. So we have all the screenings outlined pretty much, right?
Mhm.
But we don't really say anything about the uptake of evidence-based programs or improving self-management skills. And I don't know if we need to do that, because would that not be inherently included if somebody checks off blood pressure, thinking, well, I need screening, but I also need to know more about how to control my blood pressure on my own? Or am I reading too much into that?
Evidence-based care.
What's the group think?
Yeah, I think they're referring to like the Stanford, program.
Yeah, I know that, but
Yeah.
yeah,
I mean, you don't
Which-
really have anything about asthma, arthritis. You do have cardiovascular blood pressure, but heart disease. You could, I don't know.
yeah, they don't list asthma or arthritis anymore in the priority under that, in this prevent chronic disease. They say increase screening rates for breast, cervical, and colorectal cancer, early detection of cardiovascular disease, diabetes, prediabetes, and obesity, and then promote the use of evidence-based care to manage chronic diseases, improve self-management skills for individuals with chronic conditions.
So
I
maybe,
think it's because the asthma rate has improved, or am I?
well, I mean, it's listed as an intervention, so maybe you could put a box, what's needed. You could have put a box that has evidence-based chronic disease management.
Put a box for chronic disease management.
Yeah, or evidence-based.
Well, yeah, I would just put chronic disease management. I know the state likes evidence-based programs, but most people don't want to do evidence-based programs.
Yeah, and that would encompass 4.3 and 4.4, because that's
Yeah.
like self-management versus,
Yeah,
evidence.
yeah.
I think that's good, but
Okay, so what did you say, Linda?
you
self-
just said chronic disease management.
Chronic disease management, a box for chronic disease management. Okay. All right. If we look at the second priority, promote a healthy and safe environment, reduce falls. That's under the focus area 1. Reduce falls, reduce violence by targeting prevention programs, particularly to high-risk populations, reduce occupational injuries and illness, reduce traffic-related injuries for pedestrians and bicyclists. Well, we got falls prevention.
Yeah, I don't think you have traffic safety.
We do not. Nor do we have occupational injuries, and do we have anything about violence? We should have a box for violence, because there's domestic violence, there's gun violence, there's gang violence, what do you think? Should we have a box for violence?
What is the screening or service, though, that addresses the violence, I guess would be my question.
Well, for domestic violence, there's a lot of services.
A lot of services for domestic violence, yeah.
I just mean like how we would word it, just because we're asking, what kind of screenings or services are needed.
Violence prevention.
Violence prevention.
Yeah,
Mhm.
violence prevention. I think we should put something in there as well, for could we say pedestrian and bicyclist safety?
I like that.
Yeah. Or you could put injuries / violence prevention. Would that cover it? I don't know. When you think of injury, you think of pedestrian safety, but
Well, they've got occupational injuries and illness as one goal. They've got reduced traffic-related injuries for pedestrians and bicyclists as another goal. And then reduce violence by targeting prevention programs, particularly to high-risk populations. So yes, there's injury in the in reduced violence by targeting prevention programs. But I don't think that lumping them all together would do justice to what we're trying to get at here. Because some of these are very specific, like
Maybe,
occupational injuries and illness. I mean, people have an occupational injury, they get cancer because of where they work, their exposure to toxins.
Are you on the same space limitations for this document as you are for the other one? Like, is it a problem if it expands to another page?
We might be able to well, we might be able to, we are at 2 pages right now. We can probably squeeze a little bit more in, but I just took a look at the 6th question. And that question is, what health issues do the people, community you provide care and need education about? And it's a list of pretty much all of what we just list here. But it's asking the question in a little bit of a different way. This is screenings and services. This is education, information and education.
Maybe what you could do is just write the list once, like combine those 2 questions and have the question be which ones need screenings and services and which ones need education. And they could just like, you could have A, B, C, D, and then they could go, you know, screenings A and D, and then which ones need education A and C, something like that. It'll save you some room. Then you can have these.
Yeah, I've been going back and forth in my head about this, and I feel like health screenings and services are 2 different things. Evaluating and then providing services, I just feel like are so different, and I wonder if we need to split the question. But then as I look at question 6, I wonder if services and education go together. I'm just wondering if we split up question 5, it would give you the ability to be a little more specific and provide more check off boxes and have it be less confusing. I don't know. What do you think?
Well, if I was a community-based organization, I'm trying to put myself in the shoes of a person who would be answering this question. If I'm a community-based organization, say I'm the American Cancer Society, I'm offering screenings, right? I want to get people screened and I want to give people services, like assistance, driving, transportation to get to appointments if they don't have the ability to get to their treatment appointments. So I'm thinking services and screenings. Who else is on? There are no CBOs on the call, I don't think. There are no counties on the call either because the counties are closed today because it's election day. So that's why they're not on the call. Who else is on the, who else haven't we heard from on the call? We heard from Stuart, we heard from, who else is on the call that provides screenings and services? Tish, are you on the call? From Catholic Health?
Yes, I am. I'm sorry, I just stepped away for a second.
Okay, we're talking about so this is a survey that you would be answering, for instance, as a hospital provider.
Right.
And we're trying to discern the differences or how we should present question 5 and question 6. Question 5 being the screenings and services that you think people need. Now, when I think of screening and services, if I were a hospital, I would think, all right, the screenings for cancer, all the different cancer screenings, and then the services that might help an individual who perhaps maybe has cancer, whether those services are nutrition, so I don't know, or do they all fall under education? Like, after you've done the screening, is it just education you're providing through services, or are services distinct from education?
I would say they're distinct because a lot of it depends on the health system, because a lot of times we could provide the screening, but maybe we don't provide the service, or depending on if they have insurance,
Mm-hmm.
We may refer them somewhere else. But a lot of times it is screenings, especially for people who don't have access.
Mm-hmm.
This may be their only health care. So we do the screenings and then try to refer them to care. Not all of our hospitals have smoking cessation, but we refer them to a program we're affiliated with.
Mm-hmm.
Like we don't,
Okay.
have memory loss services, but we could certainly refer people to those services that we're affiliated with community partners.
So you've done the screening as a hospital, you've determined a person is a smoker, but you yourself don't have any kind of smoking cessation programs, but organization ABC does.
Right, and then some of our entities do have it, like St. Francis has a program they do with Zoom, and Good Sam does one with the county. So it depends on the entity.
Okay.
We have some programs for the uninsured for a well visit, but not too many. So we may refer them outside of Catholic Health if they're uninsured to a sliding scale entity.
Mm-hmm. I'm beginning to think that question 6 isn't even needed. If we are talking about screenings and services come with education. They are education.
Yeah, I say.
Right?
Yeah.
So I don't know why we have questions. What types of people in the community provide care to, and what do they need education about? Well, if you screen them for a problem and then you provide either an in-house service that you have, or you refer them to an outside agency, that is information, that is education and information.
But sometimes you encounter people that you're not actually screening. I just know at our events, people like, oh, no, thanks. They don't want to be screened.
Mm-hmm.
But we keep the education from all our partners. And sometimes, like I think about like the library, they don't do the screenings, but they know what people are coming in looking for. Those are the people who might answer number 6. Like, hey, where do I go for suicide prevention education? They might ask that at the library, even though they're not doing it. I think depends on who's answering the questions. It might be important.
It does.
That makes sense.
That makes sense too, which is why there probably is that separate question number 6. What health issues do people you provide care need education about?
Because we'll, at our events too, we'll leave out educational programs that our partners offer, or just even if they're not formal partners of ours, I know that they're offering a service that we don't, and I'd rather provide the education to the community. Because I find usually it's a lack of knowledge is why people don't access things. It's not that they don't know they need them, but they don't know where to find them. So this might be an answer for somebody who says, I keep getting, I get asked a lot, where can I go for dental screenings? Even though, only our St. Charles has a clinic, but a lot of people lack dental and don't know where to go. So I always keep that information at our events, even if it's not a service I can provide, I can give them info.
Okay, all right, wait a minute now. Right, well, let me go back to this prevention agenda priority list. We were talking about violence. Where did we end up with violence? What did we decide to do? Violence prevention? That's not a screening but there are services for domestic violence. There's a lot of services for domestic violence. Does that fall more under education now?
I think it would apply to both questions.
Yeah,
Just my thought.
violence prevention. Occupational injuries and illness. I don't think that needs to be pulled out separately. I think it's covered because that has a lot to do with toxins in the environment, right? Occupational exposures. You know, if a person happens to be a steel worker, what are you supposed to do for them? Tell them, well, don't, you know, be careful when you walk on the beam. They know that. So I don't think we should tease that one out. I don't think we need to tease that one out. I do think we have to say something about promote pedestrian and cyclist safety, though.
I
Because
think that
that's
fits, yeah.
that one is specific. And it's not really covered elsewhere, I don't think.
That feels
is
like
every-
more number 6 to me.
You think that's number 6? What does everyone think about that? To put under number 6, prevent, or what do we call pedestrian cyclist safety information or something like that. I think that fits under 6. Does everybody agree with that? No response, I take
Yeah,
as
no, I
a-
think so. I think
take
so. I'm
as
just
a
reading it
yes.
over. Yeah.
Okay. All right, it's not, because I want to get through this. We're still on priority number 2, promote healthy and safe environment. Focus area 2 is outdoor air quality. Reduce exposure to outdoor air pollutants. Would that again be information, education about air pollutions or air pollutants and toxic chemicals, environmental chemicals?
Maybe like environmental,
Well, focus area 3 in that priority is the goal is improve design and maintenance of the built environment to promote healthy lifestyle, sustainability, and adaptation to climate change. I don't think we're going there. And the last one goal in that section is promote healthy home and school environments. Focus area 4 is water quality. Focus area 5 is food and consumer products. For fear of getting too far into the weeds here, I think we should just be concentrating on ensuring that our choices correspond to the priority and then the focus area under that priority. And the goals that are becoming very specific. I think we could go on and on adding boxes if we start to look at it to that degree. What does everyone think about that? I'm leaning off to the side here. I'm half out of the screen. Because, you know, water quality, built in indoor environments, healthy homes and school environments, outdoor air quality. What about a box with information on, I don't know if it's here, air, water quality, toxic pollutants or something like that.
I'm almost thinking like environmental preservation. That might cover like air, water. It doesn't really cover the home and school environments as much.
Well, I don't know, preservation to me conjures up a whole different,
Okay,
that's just me.
yeah,
I think if we just say people want knowledge about water, air quality, and then air quality, whether it's indoor or outdoor, we don't have to specify.
good point.
Food and consumer products, awareness of potential presence of chemical contaminants and promote strategies to reduce exposure. That's toxic chemical, like that's toxins that exist in the environment. So I think air quality, water quality, and toxic chemicals. But air quality includes toxic chemicals. Water quality includes toxic chemicals.
Would
What does
healthy
the-
environment include everything? Could you just say healthy environment, promote and educate on healthy environments?
I think that's too broad.
Too broad? Okay,
Yeah, because there are a variety of environments, right?
true.
Indoor environments, outdoor environments, work environments, home environments. I think
Air and water.
information, they seek information on water and air quality.
What
Um,
about,
Separate?
what if you say air, water quality and other environmental toxins or something like that?
Yes, that's good. How about that? Brooke, I
Sure.
hope you're writing these down.
I am. Don't worry.
She's got the hard job of transfer. She's the scribe.
You hear me furiously typing, don't worry.
Yes, I think that covers it. Linda, what do you think?
Linda had to jump off for another
Oh.
meeting, actually.
Oh, she's, okay. Kristen, how about you? Did Kristen jump off too?
No, I'm here. I was just a little slow to unmute, sorry. No, I think that, oh, go ahead.
No, you go. I'm afraid
No,
I'm
I
putting
think-
everybody to sleep.
No, I think that sounds good.
Okay,
We'll have air and water quality as one option and other environmental toxins as another.
right.
Okay.
Because then I think that it covers it all. Then the third priority is promote healthy women, infants, and children. And the first focus area is maternal and women's health. The second, and I'm just going to look at the focus areas now, because I think when we get into the goals, it's dragging us too much into the weeds. Focus area 1 is maternal and women's health. And that means we want women and children to be healthy and have preventative services. Although one goal there is reduce maternal mortality and morbidity, which is a big push in the state right now. Then I got perinatal and infant health, again, reduce infant mortality and morbidity, and child and adolescent health. Support enhanced children and adolescent social emotional development, increase supports for children and youth with special health needs, reduce dental caries among children.
I almost feel like those 3 could be options for number 6, but what do we already have? Prenatal care.
And there's dental screenings.
There's dental screenings. Is there emotional health? Well, there's mental health depression,
Right.
which is emotional health,
Mhm.
sort of, I guess. We don't have anything about special health care needs, dental caries. Breastfeeding is very specific. We could add a box on breastfeeding. Although if we say prenatal care / breast, no, that's different. Well, prenatal care will speak to reducing maternal mortality and morbidity.
Mhm.
And breastfeeding will speak to reducing infant mortality and morbidity, even though, you know, they don't necessarily want a program to respond to every one of these areas. These again are inclusive and general terms for improving health. So what if we put just breastfeeding? Because maybe a lot of people do need information about breastfeeding. I know I could have benefited from that when I had my kids. They just threw me to the wolves. I didn't know what the hell I was doing. What does everyone think about that? Under 6, adding another box for breastfeeding, because we have routine well checkups, which covers children and adults.
Routine well checkups.
Yeah, we have dental screenings. We have prenatal care. If we have breastfeeding, I think that would speak to the infant health
I think that's
and
good.
mortality. So add a box for breastfeeding. Does that sound good?
Yes.
Okay. Moving along. Priority of area 4, promote well-being and prevent mental and substance use disorders. Hopefully, I think we got this covered. Focus area 1, promote well-being. Focus area 2, prevent mental and substance use disorders. And in there, what do we have? So we have information on drug and alcohol. We have screenings for drug and alcohol. Do we have information that's sought for drug and alcohol? And they're specific: opioid and other substance misuse and deaths, prevent and address adverse childhood experiences, reduce prevalence of major depressive disorder, prevent suicide, reduce the mortality gap between those living with serious mental illness and the general population. I think pretty much we have all of that covered between 5, what's listed in 5 and 6. Strengthen opportunities to build well-being and resilience across the lifespan. I don't even know what that means. That means take care of people well and make sure they have enough food and they have access to health care and they have good jobs. That's what that means. I don't know what else to say, and that they're not isolated. So we cover drugs and alcohol. We have mental health, depression, suicide prevention. What do you think we cover it in what we have in between 5 and 6? Because I think we do.
I think so. Just a question related to terminology. Do we want to call it substance use, misuse instead of drug and alcohol?
Do we want to call it substance misuse and
Slash use.
No.
Right. Instead of drug and alcohol, just, you know, I just, it seems like that's more the current terminology. That was my only reason for asking.
Yeah,
that.
they're using substance misuse rather than substance abuse, they say substance use disorders.
Right. I'm just
Okay.
thinking to keep it
Yeah.
consistent with the terminology from
So
the,
substance misuse, so instead of drug and alcohol, substance misuse and
Substance use / misuse.
right, or just substance misuse. I'm not sure which would make more sense.
I think substance misuse.
Yes.
Is everyone good with that?
Good.
And then the last priority area, I thought we were going to have a quicker meeting today. Sorry, we didn't. Prevent communicable diseases, vaccine preventable diseases. Well, we want to improve vaccination rates. Well, let's see. Vaccinations, immunizations, we have that in 5 and we have that in 6.
Mhm.
We want to reduce vaccination coverage disparities. That's okay. HIV, we have that here, HIV, AIDS and STDs, information and services. section STDs, hepatitis C. Now they pull out hepatitis C separately, and I guess that's because Hep C has become so more prevalent, right, among that 50 plus age group or something now. Although I don't think there's routine screening for Hep C virus. Even though there's a lot of, I see TV commercials that say, oh, you should ask your provider if you have been exposed to Hep C. No provider I've gone to has ever said you want to be screened for hepatitis C. Does it warrant a separate, like HIV, AIDS, and STDs have their own box? Does Hep C warrant its own box? Or do you think people might want information about hepatitis C?
Yeah, that could be.
I mean, what are you guys are out there treating people? What has this like been an issue that's come up at all? I don't know why the state has this in here. They must have data pointing to something that made them put this in here. I mean, has there been a prevalence of Hep C cases in the hospital? People in the hospital, do you find it regularly when you do blood work?
I honestly don't know, to be truthful. I'm not sure what the rate is.
And I don't know either.
No.
Yeah.
Maybe under for education, we should just put another box, Hep C, hepatitis C.
We'll cover it.
Yeah. Okay. Antibiotic resistance and reduce that, improve infection control, reduce infections, reduce inappropriate antibiotic use. That would be information. We would want to give people information about that. Although we've been providing information about infection control through all the messages about good hand washing and hand hygiene.
Sure.
That's been ongoing. Would somebody be, would a CBO be interested? Would they feel that their community, that the people they serve want to know more about infection control practices? Do you think they'd want to know, and does it warrant a box that a person would want to know more about antibiotics resistance? We have, that is a topic that has come up a lot, that they've been so overly prescribed. One of the reasons why there's resistance, which then leads to those infections spreading in healthcare settings and other congregate settings.
And
Do you think it would
antibiotic.
make?
Yeah,
Sorry.
no, go ahead.
You go, Stu.
I was going to say, antibiotic stewardship has become a big thing at hospitals, and I know we
Yeah,
have
okay.
a separate committee that just looks into that and really works on reducing the use of prescribing of antibiotics.
Yeah, overly prescribing them.
Yeah,
So should we have a category, a box that says antibiotic resistance?
sure.
For number 6.
Yeah, just information. And, we might, I don't think that's such a bad thing, because I think more and more people are becoming aware of that, and maybe more people want to know more about it and we don't realize it.
Could be.
So what do we think? Did we get through this?
I think so.
I think we did.
Okay. Good, because it's going out in like 2 weeks. Okay, so what's our next slide? I think where are we? We went through all the questions. I'm sorry, this is very tedious, but I don't know any other way to do this. Really, we're up to additional questions and concerns. I went through the timeline. You'll get a summary of this meeting with all of the decisions that we made and a clean CBO survey with the link to where it will reside in SurveyMonkey. And then it will be sending to each of you. I'll send out my explanatory introductory letter with the link to the prevention agenda priorities, explaining to the CBOs and the hospital individuals who'll be receiving the survey why we're doing it and why there are the certain categories that are listed in the questions. I'll also provide you with a very brief blurb that you might want to send to organizations. Before I send the survey out to organizations that aren't listed, that you send to me that I should send the survey to, I can provide you all with a blurb that explains, hey, Mr. John Smith of blah, blah, blah. I work with the Law and Health Collaborative, and you're going to be getting a quick survey about the services and needs of the communities you serve. Could you please, when it comes in your mailbox, could you please complete it? Just something like that, just kind of like a bridge. And then we'll take care of sending all the surveys out as long as you give us those CBO contacts that are not yet listed in that list that we've provided. So there's a few items coming from us in the next week. The summary with the consensus CBO questions and the new CBO survey with all those questions and boxes and all that stuff added. A quick blurb for you to use as an introductory in an email you send to your CBO partners who are not listed on the collaborative's list right now. And then the letter that we will write that explains why we want any CBO or any hospital rep or any public health rep to complete the survey, along with a link to the prevention agenda priorities, and that this survey is draws from and includes references to the prevention agenda. And that's why you see, and then talk about the COVID issue as well. That COVID is inherently covered in all of the different categories that are listed. Does that make sense?
Mm-hmm.
I think I lost pretty much everybody on this call. I'm just about at it too. So I think we're really in good shape. So the next call is December 7th, I think. And I don't really think it shouldn't be a 2-hour call, because at that point, the CBO survey will be out in circulation. The CHAS survey is always out in circulation. I mean, we only might be reporting on who's responded, who hasn't. Maybe we might have to decide we have to make a phone call to this organization or that organization to prod them a little. But that's really all I see us needing to do the next time around. We won't have to do anything tedious like this ever again. At least not for another 3 years. Sound good?
Sounds good.
All right.
Sounds good.
I gave you back a half an hour.
All right.
And I'm very happy about that. And if you haven't voted yet, don't forget to vote.
Absolutely.
Very important. We've got to keep this world sane.
Good luck.
We're trying. Every vote matters.
Exactly.
Okay, so I'm going to sign off now. I thank you all for your participation once again, and I promise it'll be quicker next time around.
Okay. Thanks, Janine.
Thank
Brooke.
you.